Does sciatica go away on its own? You may have started recently struggling with sciatica symptoms and you're wondering, will this problem go away? Do I need to go see a medical doctor? Do I need to go see a physical therapist? Do I actually need to get help for this problem? Or is this just going to naturally go away on its own? If you're struggling with sciatica, this is probably your biggest question because you want to know, is it going to go away? Do I just have to wait this out? Or do I need to see a doctor right away? Or is there someone else who's better equipped to be able to help me walk through this situation? And it's not a simple answer, but it's what we're going to go into in today's video. So, does sciatica heal on its own? Well, yes, maybe, kind of. I know that that's a really broad category, so I need you to stick with me and we're going to break down each of those answers. Does sciatica heal on its own? Yes. If your sciatica is being caused by pressure from the disc onto the sciatic nerve. So let's remember that sciatica is an irritation of the sciatic nerve, most commonly by a herniated or ruptured lumbar disc. So those discs are the ones in our low back. They can either herniate, which means they kind of bulge out, bulging disc is another word that's used, or they can actually rupture where some of the discal material actually comes out and it kind of bays around that nerve and it causes a lot of irritation. So the nerve gets irritated and zoop, it zings pain down the leg. This can actually heal. So ruptured discs can heal. Herniated discs can heal, and it's beyond the scope of what we're going to talk about today. But if you're interested in understanding more about how discs heal, then I encourage you to watch this video here. All to say for today that discs can heal, which decreases the stress on the sciatic nerve, which decreases your sciatic symptoms. So yes, sciatica can heal and your symptoms can go away completely on their own. However, that is assuming that the disc is moving correctly, which means the joints, the muscles, the ligaments, and the tendons are all moving correctly, because movement is life and every tissue in your body is designed to be able to heal itself, and that includes your discs. However, if they're not moving correctly, which I've got to assume that they're not moving correctly, why? Because you started having sciatic pain in the first place. So if they're not moving correctly, then it is not able to heal. That takes us on to maybe. Many people struggle with this concept because your tissues can actually heal, but it's got to be the optimum environment. And I'm assuming that your body's not in the optimum environment because you have this sciatica pain in the first place. If your body were in the optimum environment, everything were healing correctly, your nutrition, your hydration, how you were moving your body, everything was correct, then these symptoms wouldn't have started in the first place. And that's where we see a lot of people struggle, is that they were doing things, activities, or eating things, something caused this problem to start in the first place, and they think if they go back to doing that thing that everything's going to heal. Well, that's not going to work. Your body can't heal under those conditions because that's what caused the current condition that you're in. So it's really important to find someone that you can work with. I would recommend a manual physical therapist who can understand a very holistic view of what got you here in the first place. Because if that disc is herniated or has ruptured, there's other things that happen. There's abnormal forces that have been going through that low back for a long time. And you may feel like, oh, I just bent over in the shower and picked up the bar of soap and oh, my disc went. Maybe you've heard of people saying their back went out when they went to pick up soap in the shower. And I understand that it did happen in that moment, but the reason why it happened was because of all this stress and abnormal movement patterns that had built up over time. Unless you've been in a traumatic accident, like a car accident, or you fell when you were skiing, or like something really traumatic, discs don't just herniate or rupture on their own. Now again, yes, in trauma and accidents, I understand that can happen. But in day-to-day life, if you're doing a normal thing that you do all the time, plugging in the vacuum cleaner or something like that, and your disc goes out, then that means that there was a pattern of abnormal movement that led up to that. And it's really important to find someone who can address that issue. You may need to see the doctor because you're in a lot of pain and you want to have things checked out, but I'm going to tell you they're not the ones who are going to address your movement patterns. You need to see a manual physical therapist who is going to look at that holistic point of view and is going to help change the movement patterns. And that's where we get to kinda. Because what happens is that people will have their symptoms go away and think that everything has healed. So yes, your symptoms can go away on their own without seeing anybody because your body can heal on its own. However, what will happen if you don't actually treat the root of the issue, what caused this problem to start in the first place, is that it will come back. So if you've heard of people who have sciatica symptoms maybe like once a year or once every couple years, or they're like, I had it 5 years ago and then I had it a year ago and now I'm having it every year, that's usually what we see. Is it's very typical to have it progressively get closer and closer together. That's because whatever was that root cause, that core issue, never completely healed. So something's going on that the movement is not happening because, again, every tissue in your body is designed to be able to heal itself as long as it's moving correctly. So if you're not moving correctly, then the tissue doesn't ever really heal. That doesn't mean that your pain won't go away though. So your pain can go away, and that's where this gets so confusing, is because people think, oh, my pain went away, my sciatica healed. Well, your pain went away, which is thumbs up, fantastic, but it doesn't mean that the root issue that caused that sciatica pain is actually gone. So that's where I recommend you find a manual physical therapist to work with one-on-one who can look at your body, figure out what is going on, what caused this problem to start in the first place. So that way you can actually heal those tissues so it doesn't come back again. So now I bet your question is, will the root cause of your sciatica pain ever heal? Well, that goes back to what we started with, is the yes question. And I'm going to describe more of what's going on with your disc and can it heal in this video right here. Have a great day, everyone.